Hello, I'm Dr. Robert Russo, Executive Director of the Connecticut State Medical Society. Welcome to On Call with Connecticut Physicians, the Medical Society's podcast initiative. Hello, I'm Dr. Bob Russo, the Executive Director of the Connecticut State Medical Society. This is our On Call with Connecticut Physicians podcast. Today's topic is going to be high deductible insurance plans. The Connecticut State Medical Society represents 4,000 physicians within the state. Its mission is advocacy for physicians and their patients. Today, Dr. Greg Schengold, our president, is going to talk about this issue and see if we have follow-up questions. So I'm going to turn it over to Greg now, and we'll begin. Thanks.
Thanks, Bob. So high deductible health plans are a recent creation. But before we get into that, we really should understand the three different parties that have relationships that sort of make up this triangle of care. So the first one, and the most important, is the doctor-patient relationship. And this relationship is really based on a trust that the doctor is going to be telling patients what's most important for their healthcare and making sure people take part in high-value, safe, quality healthcare. Now, supporting those relationships, physicians oftentimes have contractual relationships with insurance companies. And these become very complicated, and the patient really shouldn't be part of those type of relationships. The other relationship is between an insurance company and the patient. Now, sometimes patients buy the insurance products on their own. Many times they're getting it through their employer. But what often happens is patients are unaware of much of the fine print. More and more over the past years, patients have an increased financial responsibility. People will hear terms like deductible, co-insurance, co-pays, but cumulatively, these are costs that patients incur above when they pay their premium. And oftentimes patients, because they're unaware of this fine print, are surprised when they have large bills that come because they access care. And so what patients sometimes do is they will avoid essential care because of their responsibility. So for example, someone has mild chest pain and they want to go to their doctor about this chest pain, but it's early in the year and they haven't reached their deductible. So they go, I'm going to avoid this visit to the doctor. And so time goes on, the chest pain gets worse, and now all of a sudden, that patient is having a heart attack. And they have to go to the emergency department and have emergency interventions to take care of this. And this is an example of when people will forego essential care because they have a responsibility. And so we really see how these high deductibles adversely affect a patient's access to care.
Talk a little bit about the relationship between the physicians and the insurance companies.
So the physicians oftentimes will contract with an insurance company. Now, there's a lot that goes into these negotiations, but eventually they reach a compromise when this is reached. But what happens now is the insurance company turns over those sort of relationships to the patient, and we're back to that interference here. So the insurance company collects the premium, but then they don't end up paying the physician for the contractual rate. They make it the patient responsibility. And now when the patient has this responsibility, they oftentimes, it just causes that interference with that trusted doctor-patient relationship. So if a patient has a surgery or they have a procedure, they may forego essential follow-up care because there is still a bill or responsible to the doctor. And really, we want the patients to have this high quality care. and not to interfere with that doctor-patient relationship. Furthermore, for the patient, it gets very confusing, especially if one episode of care leads to an interaction with multiple providers. So for instance, if someone again has appendicitis, as we used in the last podcast, they might have 5 or 6 different bills come to them, and this becomes very confusing. And so what we propose as a better solution is that the insurance companies pay the physician based on the contract that they have, and then the insurance company can collect any patient responsibility from the patient. And that way, it's much more streamlined and it's much less complicated for the patient.
Yeah, I believe that patients, when you get multiple bills, you really don't know the sequencing, you really don't know how to handle it. And to go to the physician office and ask where the information isn't actually, because a lot of physicians don't know where the other bill came from or anything about it or how to help with that sort of thing. So I find that hesitancy that you're talking about is severe, actually. If you owe somebody money, you're uncomfortable going back into their office and asking for additional help when you haven't paid your previous bill. That sort of interference ruins that sort of relationship that has to do with, first and foremost, good quality care.
Absolutely, Bob.
Now, you were on a task force, the high deductible health plan task force from the legislature. Can you tell us a little bit about that?
So this has been one of our priorities for the past couple of years. So last year, the legislature authorized having a task force. And so in the end of 2019 and through January of 2020, we completed our analysis of how high deductible health plans are interfering with quality, safe patient care. And so we issued a report, which is available to everyone. But in there, one of the high recommendations voted on by a majority of the task force is the plan that I just described, where an insurance company will pay what the contractual relationship is to the physician. And if there is a patient responsibility, the insurance company will go about to collect that. Now, sometimes that cannot be done right away through people's health savings account or HSAs. People fund these throughout the year, but many times early on in the year, there's not enough money to cover those services that are needed at the time that they are needed. And so if we did have this relationship, these multi-billion-dollar huge organizations called insurance companies can then collect that money over time versus a small doctor's business, not to mention how it interferes with that relationship that we've talked so much about. Now, one of the things in there is that we determined during this task force is that HSA money can be used to pay the insurance companies, and that was authorized through the regulations. And so we do feel that that's there. There's also was other conversations during the task force about high value care and how high deductibles deter high value care as much as they deter non-essential care. People talk about that patients need to have skin in the game, but when they have too much skin in the game, it really is deleterious to their health because they avoid that essential care as much as care of whatever that term means of non-essential care. So these plans have really not helped our health at all in Connecticut.
Yeah, you can easily see, I think, that this kind of mismatch of who the contracts are with and who should be collecting the bills and things like that is a major issue. Very confusing for patients and very burdensome for the physician practices. So I want to thank you for your input and thoughts on this issue, and I'm sure I'll see you again in another podcast soon. Thank you.
All right, thank you, Bob.
Thank you all for listening to our conversation on the Connecticut State Medical Society podcast. Please use the contact information provided here for questions and more information related to the legislative activities in the 2021 session. You can listen to other episodes of On Call with Connecticut Physicians at the Connecticut State Medical Society's website, csms.org. Be sure to engage with CSMS by following us on Facebook, Twitter, and LinkedIn. We look forward to seeing you here next time.